Hi everyone, I am Rosalyn Anita, nursing tutor in Tribulum College of Nursing. Today I am going to present collection of blood for culturing. Objectives: introduction, definition of blood culture, list the indication of blood culture, explain blood culture to detect infectious disease, list the principles of blood culture, state contaminated blood culture, enlist the material needed for blood culture, enlist the steps of blood culture, conclusion and reference. Introduction. The bloodstream is usually a sterile environment. The isolation of any organisms from a blood culture must be considered significant and correlated with the clinical picture. A blood culture is a fairly routine test that checks for bacteria, yeast, and other organisms in the blood. Blood cultures are collected from patients with suspected sepsis or bacteremia. Blood culture is a laboratory test in which blood is injected into bottles with culture media to determine whether microorganisms have invaded the patient's bloodstreams. Indication of blood culture: endocarditis, fungal infection, gonococcal infection, chills, confusion, and fever. Blood culture is done to detect infectious disease. Blood culture is a microbiological culture of blood. It is employed to detect infections that are spreading through the bloodstream. This is possible because the bloodstream is usually a sterile environment. Coming to the principles for blood collection. Gloves will be worn in accordance with standard precautions. A physician order must be obtained for specimen collection. Appropriate verification of the patient's identity by means of an armband or area specific procedures will occur before the specimen collection. Culture should be drawn before administration of antibiotics. Blood culture should not be drawn from lines but should be drawn via venipuncture. Contaminated blood culture. If the skin is not adequately cleansed before drawing blood for culture, bacteria on the skin will be injected into the bottle, producing a false positive blood culture. It is sometimes difficult for the physician to determine whether the bacteria growing in the blood culture is a real pathogen causing bloodstream infection or whether bacteria on the skin have contaminated the culture. This can lead to excess use of antibiotics and prolongation of hospital stay. Materials needed for blood culture: alcohol swabs, blood culture bottles, 2 bottles per set, 2 syringe, adult 20 cc, pediatric 5 cc, 2 needles, adult 22 gauge or preferably larger butterfly or standard needle, pediatric 25 or 23 gauge butterfly or standard needle, and gloves, sterile or non-sterile, tourniquet, sterile gauze pad, adhesive strip or tape, self-sticking patient labels, plastic ziplock, specimen bags. Procedure: Step 1 to 3: check, explain, and wash. Identify the patient by checking the armband or area specific procedure and explain the procedure to the patient. Wash hands with soap and water with friction for 15 seconds or use alcohol based hand rub. Step 4: prepare cap. Prepare the rubber cap of the blood culture bottles with your alcohol pad in a circular motion. Allow the alcohol to dry. Coming to the step 5, prepare the puncture site. Using aseptic technique, remove the applicator from its package. Holding the applicator downward, gently squeeze the wing to release the solution. Scrub with a back and forth motion using friction for 30 seconds on dry skin or 20 minutes on wet skin. Do not wipe the site after cleansing the skin with chlorhexidine. Step 6. Draw blood. Adult, pediatric and infant. The syringe needed for the adult 20 ml, aerobic bottle 10 ml, anaerobic bottle 10 ml. Pediatric, syringe needed for 20 ml, aerobic bottle 2.5 to 10 ml and anaerobic bottle 2.5 to 10 ml. In infant, syringe needle is 3 ml, aerobic bottle 0.5 to 1 ml, anaerobic bottle 0.5 to 1 ml. Do not overfill bottles. Step 7. Mix. Gently rotate the bottles to mix the bottle. The broth do not shake vigorously. Coming to the steps 8 and 9, label and send. Place the patient label on each bottle and label each culture bottle with the site of specimen collection. When applying the patient identification labels, do not cover the barcode label on the bottle culture bottles. Attach the laboratory requisition and send the culture bottle blood cultures to the clinical microbiology receiving area as soon as possible. Coming to the step 10, documentation. Document the following in the medical record: date and time, specimen obtained, site of specimen collection. Coming to the conclusion, detection and identification of agents of sepsis is one of the most important functions of clinical laboratory. Select the blood culture media that will allow optimal propagation of all organisms. Perform limited workup on potential contaminations for all sterile fluids. References: Murray P.R., Trainer P. Hobson, D. Critical Assessment of Blood Culture Techniques, http bar www.slideshare.com and slideshare bloodculture.com. Thank you.